इम्तिहान हो गई इंतजार की, आई ना कुछ खबर मेरे यार की.
I think there was some inner connection I was not sure about. Maybe coming from my father, as I saw him doing medical practice as I was growing up, again brought me towards it, and I got hitched into medical medicine, which I'm sure was a good decision because I like it to my core. I'm Dr. Arunesh Kumar. I'm Senior Consultant Head for Department of Pulmonology, Sleep and Interventional Pulmonology. I trained in UK. I went to United Kingdom and I trained in a very beautiful part of England called Yorkshire. I came back to India to set up a respiratory practice. I will wake up at around 7ish, have a quick morning walk for half an hour, grab my cup of tea. Then I get ready and be at the hospital for around 9 o'clock. Do my ward rounds, which is around 1.5 for the inpatients. And then I'm in my OPD till about 4:30. Sleep is very important because it resets your brain, and that's why if we see in people with obstructive sleep apnea, it's just not about sleep disorder. It can cause diabetes, can give somebody stroke, it can cause multi-organ heart dysfunctions, you name it. So for human body and your brain, a good 7-hour sleep is important. My job is a bit stressful, and for doctors, for medical staffs, you should have your own time. And for me, it's music. It's reading, it's talking to my wife, who happens to be my best friend as well.
He shares his stories that how some patients were not doing well, now how it is doing well. And that gives me really a kind of satisfaction. I feel proud.
So me and my wife both were preparing for pre-medical test way back in
1992. We were good friends, just good friends, good competitors, yes.
Who will try and get
we try to beat each other in all the class tests.
So I was the gold medalist of final MBBS. So getting to know that, I'm the topper. Academically, that was the happiest memory. Remember the COVID pandemic where whole world was shut down, but we were not shut down. So we had wards and ICUs full of severe COVID patients. Some of the patients not getting back home. So during COVID time, I would set off at 7 o'clock. So for 1.5 years, I made a routine not to eat and drink in the hospital. I will be in the hospital from 8 to 8 p.m., 12 hours, without any drop of water, without any food. I said to my team, if you communicate well, half work is done. Medicine comes second. So you need to be a keen listener and keen orator as well. Be very explicit in what you talk and in a very simplest term. This is the first key which establishes a good rapport between you and your patient. Somebody comes in who is very unwell, he can't breathe properly, and 2 days down the line you send him home getting hell and hearty, and you made some change to their lives. I think this is the biggest reward you get as being a doctor. I think this is the biggest happiness you can get out of it, and I'm proud to say that there are only a few professions in the world where you get a happiness like that.